what is diastasis recti? This is a topic online that can be very muddled and very confusing. So we're just going to quickly clear up what is actually happening when you get told you have diastasis. So all of your abdominal muscles, that deep core, that deep transverse abdominis, the six-pack, the rectus, and the obliques all insert into a tissue down the center called the linea alba. So when you're pregnant, obviously we have to make room for baby. So pretend this is the tissue. It stretches, right? It stretches and stretches and stretches for months. And afterwards, when the baby is out, everything is trying to go back to how it was, right? All your organs are moving back down, everything's adjusting, your core is having to strengthen, you're having to do all that stuff to kind of rehab and feel strong again. That tissue has to recover and feel strong again as well. And so that's part of why we do core rehab and focused breathing and then move to exercises and things like that, is that not only the muscles need strengthened after stretching, that tissue needs strengthened after stretching. So usually if you're getting told that you have diastasis recti, it should be, not always, because I know a lot of times you go to the OB and if they even check for it or if they even mention it, they're checking for it at 6 weeks. And that's just not a realistic time frame for most people to check for it. Most people will still have it then, not everyone. But generally you want to check like 10 to 12 weeks after, so 10 to 12 weeks postpartum. And what we're checking for is how that tissue is doing. So the tissue has been stretched. Has it come back together? It doesn't have to come back together all the way to how it was postpartum, but has it come back, or is it very, very stretched still? Is there any tension in that tissue, or is it very lax and you can put your fingers really deep in? Those are the things that we're really checking for here, because those things are both going to determine how your function is. And the main goal with diastasis is function. You want to be able to do the things you love without back pain and issues and all those things. So when you get told that you have diastasis recti, make sure that it's been 10 to 12 weeks. And remember that it's not the end of the world. You can focus on your breathing, learn how to breathe properly, learn how to connect to the deep core well, and you can rehab that back to function. And a lot of times with function comes the aesthetics that we're looking for as well. So even if it doesn't go all the way back to pre-pregnancy, you can have function and you can have, a recovery with that diastasis. So what you're looking for here, generally, technically, wider than 2 fingers and very weak tissue is what is going to get diastasis diagnosis, or just told that you have that. So just make sure though, like I said, you're not checking too early, you don't check in pregnancy, and that you know and remember that it's not the end of the world, it's just a reflection of how that tissue is doing, and that you need to do some work and some rehab to get back to function and strength. And welcome to today's upper body. We've got triceps, back, and a little bit of core thrown in. So first thing we're going to do is a bird dog row. We're going to come down to the mat. I like to have the other dumbbell here even though we're just doing one single side.